We examined whether distinct blood pressure phenotypes or categories could be determined based on central to peripheral blood pressure transmission and whether standard blood pressure cuff measurements could detect these phenotypes. We discovered 4 distinct blood pressure phenotypes based on central to peripheral blood pressure transmission that were different based on invasive aortic blood pressure, but the cuff could not detect these differences. We performed standard blood pressure cuff and invasive aortic, brachial and radial blood pressure measurements in patients undergoing coronary angiography at our local hospital. We developed the protocol specifically for this study. At the end of the clinical procedure, the catheter was positioned in the ascending aorta and flushed, and then steady, stable waveforms were recorded for 20 seconds. The catheter was then pulled back or withdrawn to the mid-brachial artery, flushed, and the measurements repeated. At this point, a standard cuff blood pressure measurement was also performed. Finally, the catheter was withdrawn to the radial artery, where again there were steady, stable waveforms recorded for 20 seconds. The invasive systolic blood pressure measurements at the aorta, brachial and radial arteries were used to define the blood pressure phenotypes. We also recorded standard cuff blood pressure not only at the time of the catheterization but at several other time points. The take-home message from this work is that there are distinct blood pressure phenotypes based on central to peripheral blood pressure transmission. These phenotypes are not detected by standard cuff blood pressure. Critically, 2 of the phenotypes had significantly higher invasive aortic blood pressure that was not detected by the cuff. This means that some patients may have risk related to blood pressure that is undetected by the standard cuff blood pressure measurements. In the future, the information that we derive from the blood pressure phenotypes may also be able to be used to improve the accuracy of standard cuff blood pressure measurements.